antibiotics, so it's not a big issue anymore, to be honest, compared to the virus-caused infectious disease. That's a big one right now, especially after COVID-19. Okay, so Streptococcus, we talk about that. Diagnosed X-ray gram stain, clinical manifestation, treatment, obviously treat with antibiotic therapy immediately. Okay, that's, so we have a PCA vaccine. We mentioned about the bacteremia meningitis related to that. Okay, Klebsiella pneumonia. This one is interesting. Klebsiella pneumonia. Klebsiella pneumonia. This is simply a gram-negative rod shape. So its name is Klebsiella pneumonia. So you may think it will cause pneumonia. Yes, but only 2%. Now, what is this pathogen mainly will causing? Is kids, infant diarrhea, and urinary tract infection, UTI. Ammonia is only 2% compared to Streptococcus pneumonia, only slightly. What's the characteristics? This pathogen looks like what? Very milky, can you see it? This is cheese-like colony. We call mucoid colony. Mucoid colony caused by heavy capsule polysaccharides. And the Klebsiella pneumonia, if you have a Klebsiella pneumonia, what happens when you cough? Looks like currant jelly. So when you eat a breakfast, did you put like grape jelly there in the middle? In the European country, they have a currant jelly. It's not a grape jelly. Similar, the brownish color, because the blood there is there. When you cough in the sputum sample, looks like that. That's possible Klebsiella pneumonia. But more interesting, what we said, the cheese-like smear. Look at the colony like a cheese-like, because mucoid colony. Very heavy polysaccharides. This is a Macanchiaga. So same as E. coli, because gram-negative bacteria, it will grow. Looks like a cheese. And why it's pink? Lactose fermentation positive. They fermented lactose. You look at this blood actor. How heavy the smear it is. Like a sticky, like you are making the cheese, eating the cheese looks like. So that's for Klebsiella pneumonia. Very simple, we introduced to you. Okay, now this is a big one. Streptococcus pyogenes. We want to talk. Okay, we talk about Streptococcus pneumonia. Then we talk about Streptococcus pyogenes. So, Streptococcus pyogenes. Okay, Streptococcus pyogenes, everybody knows. This is a pathogen responsible for strep throat. And I tell you one thing, the joke, I teach another microbiology class with 130 students. Before the pandemic, the COVID-19, the most excuse if they don't attend the class is, Dr. Shen, I have a strep throat in the morning. No, so then I told them, what's a pathogen? Streptococcus pyogenes. What this pyogenes means? PYO means pus. What is a pus? Dead white blood cell. What is gene means? Genetic. Okay? Now we want to explain to you one thing. Lots of the textbook write group A beta hemolytic strep. Okay, so we know Streptococcus pyogenes is beta hemolytic. Okay, what means group A? Lots of the publication, newspaper, media report suddenly comes on the group A Streptococcus. There is a story we can talk to you. There is a great American clinical microbiologist, Rebecca Lansfield. A great American scientist. Back in 1920s, she did a lot of the study in rabbits. So he inoculated rabbits with different streptococcus, and then have antigen-antibody reaction to see the precipitation. And based on the precipitation, he can grouping different streptococcus into different group. There is a long list. But in the class, we only going to talk about a couple important ones, which is group A, Streptococcus pyogenes. Group B, Streptococcus agalactiae. Remember, we just talked about this. Women at 35, 37 week pregnancy need to do a screening test. Otherwise, newborn baby will have meningitis, bacteremia, septicemia. And group D, Enterococcus facilis. Very interesting. That's why this is called a group A strip. Now, when they do this research, the classification, we say, they based on antibody-antigen reaction. The precipitation rely on protein, especially the M protein in the cell wall. Which means you grouping them, they must have M protein. There is an exception. The pathogen we just talked about. Streptococcus ammonium, there is no M protein. So, this strep is not belonging to any of the Rebecca Lansfield group. We just write NA. That's a very common question people have. They say, oh, you talk about Streptococcus pyogenes, it is group A. You talk about Streptococcus agalactiae, it's group B. Or you talk about Enterococcus facilis, it's group D. But how come where is Streptococcus ammonium? You just talked 5 minutes ago. It's the most important one. Why did it not belong to any group? Because it doesn't have M protein in the cell wall membrane system. So that's very interesting. We talk about that. Okay. The last one. What is the Enterococcus facilis? This pathogen originally belonging to Streptococcus. In the history. Later on, it isolated and became an independent pathogen. This pathogen is very interesting. This is resistant to 1.5% bile salts. So resist to the salts. In the growing of a special agar, okay, is called bile-esculin agar. It will be a black colony because they change bile-esculin become bile-esculatin. And later on, you know what happened? Enterococcus facilis. If the enterococcus become a facillian, I don't know, Corey talked about that in the feeds. We did the enterococcus facillian as a surrogate bacteria for salmonella. Because in the WVU farm, the poultry farm, we cannot use pathogen. They are processing the birds. If we have a pathogen, it will cause outbreaks. So we need to use a surrogate bacteria. And the surrogate bacteria for salmonella is Enterococcus faecilis. It's the same genome for Enterococcus faecilis. So very interesting. Here are some of the topics we can mention. Okay? Yes?
Why is there no group C?
This is just what we're focusing on.
Not important.
Cool.
It's not a focusing group. Yes, you're right. Group A, B, D. When you look at the news, you go to see a doctor, they will all have these. But you're right, there's a long list.
Okay.
Yeah. Okay, Streptococcus, what will happen? Now I'll go different, a little bit briefly here, okay. Streptococcus pyogenes, at the beginning, they are not all of a sudden have strep throat. They started to infection is on the skin surface. Just showed you a dot cell, a swelling dots. That's called the apical epidermis. That's the first stage. It's just simply say epidermis. And it's called empytigo. That's the first stage. Second, underneath your skin surface, it starts to show these things like this. What it looks like? A bee house looks like. We have a terminology for that. Serolitis. That's the second stage. This tells you this pathogen is invasive. Then they become strep throat. And then you go to see a doctor, you see strep throat like that. The doctor gave you antibiotics. You think you're recovering. Unfortunately not. You may have a sequela, which means a disease followed by recovering of the main symptoms, called post-streptococcal disease. Could have two. Glomerulonephritis and rheumatic fever. What is glomerulonephritis? Kidney disease. The kidney filtration system is damaged. So in your urine sample, you may have a protein, you may have a glucose. What is rheumatic fever? Fever with joint pain. So just want to tell you one thing. Streptococcus pyogenes called strep throat is a very invasive toxic disease. We have to use antibiotics immediately. It's not going to have fun. So I told everybody, don't make fun. Don't make that excuse. If you have that one, it's going to be damaged. I'm telling you. Most likely what you have is still a virus. It's a common cold virus. It's not a strep throat because strep throat is more severe invasive pathogen. Okay, so that's something I want to mention here. This one is easy. Group B streptococcus. Gram-positive. Neonatal, newborn baby have sepsis, meningitis, pneumonia. Vagina become a source for newborn. So woman 35, 37 week have to do a screening test. Otherwise, you have to use antibiotics because it's going to cause a newborn baby meningitis. Okay. Same thing. we talk about this P disc is optical. We have Streptococcus pyogenes. You have a Streptococcus agalactia. How are we going to differentiate? Still blood agar, we using A disc. The components of A disc is basic tracing. It's a chemical. It's antibiotics. We're going to mention about this when we talk about penicillin. It's very interesting. And then what happened? Streptococcus pyogenes is susceptible to the basic tracing, so it's transparent zone. And Streptococcus Streptococcus agalactia is resistant. So if you have an A disc, it still grows. So this is very simple, easy. We have a blood agar. You put a disc there. You just look whether it grow or not. How do you know it's growing? You don't have a transparent zone. If you have a transparent zone, which means it's inhibited. And here you can see pyogenes, beta hemolytic, when you have an A disc there, completely inhibitory zone because surrounded here it's transparent. That's for pyogenes. But agalactia, which is group A, it's not. It's resistant. It looks like here. Okay? So we stop from here. Next week, Tuesday, we will talk about the Staphylococcus and the Clostridium. Staphylococcus is another big group. In the clinical area, we can put a table to do the conclusion of Staphylococcus and the Streptococcus. We'll just let you know the results. In my major class, we have to do some of the experiments lab to show all of us what it looks like. We don't have the lab, so we'll just tell you what it looks like in a table on the blackboard to show you. Okay, so you can take a pictures or go back watch the video. Some of them will be useful for answering the case study in the exam 2 questions. Okay, so that's all we have today.